What conditions improve with CAM, or complementary and alternative medicine? My name is Rusty Owen Brink. I'm a board-certified family physician who's worked for over a decade as an integrative physician, merging the best of complementary and alternative medicine with traditional medical practice. The first topic we'll discuss today is acne, and our source for this discussion, as well as many other discussions, will primarily come from the Encyclopedia of Natural Medicine, second edition, edited by Murray and Pizzerno et al. Acne is the most common of skin problems. It affects more men than women. It occurs during puberty due to increasing action of testosterone and long-term antibiotics, which can cause an overgrowth in candida and alteration of skin flora, or the normal germs that live in your skin. Medications that can cause acne should be avoided. Things such as steroids, contraceptives, progesterone-containing drugs, which are common in contraceptives, also drugs containing iodides or bromides. Also avoid exposure to oils and greases, and eliminate refined and or concentrated sugars and trans fatty acids, which can be found in margarine and shortening. Nutritional supplements helpful with acne include chromium, 200 to 400 micrograms daily, vitamin A, 25,000 units a day. Higher doses may work better, but pregnant and sexually active fertile women should remain below the 5,000 international unit per day dose to avoid the potential for birth defects. Vitamin E, 400 units a day. Selenium, 200 micrograms daily. Zinc, 45 to 60 milligrams a day. And pantothenic acid, or vitamin B5, 2.5 milligrams 4 times a day for up to 2 weeks, can help with acute flare-ups of acne. Physical medicine. Acne tends to improve with exposure to ultraviolet light. Topically, you can choose one of the following: tea tree oil, 5 to 15% preparations, azelaic acid, 20%, and sulfur, 3 to 10% applied to the skin once or more times daily, as per directions. The medical therapy of addiction is another area that I'd like to touch on. Addiction is a progressive disease. It's very pervasive. It's found all over society. All segments of society are susceptible to this. So as a quick review, there are some medications that can be used to treat addiction. Red flags for addiction include what's called the CAGE questionnaire. Do you find that you're concealing the amount or frequency of use? Are you annoyed when others comment on your use? Do you feel guilt about the use, the amount, the frequency of it? Do you use an eye opener, needing a bit to get going in the morning? This has been a very helpful questionnaire with a great sensitivity. If you have one or more of these going on, you probably have an issue, and certainly the more points that you score positive for, the greater your issue is likely to be. Addiction has been described as cunning, baffling, powerful, and I would add to that ruthless and lethal. But it can be stopped with help. What is addiction? It's a pattern of continued use of substance or behavior despite adverse consequences, social consequences, employment consequences, medical, or legal. This is happening despite a desire to stop. Behaviors such as sex, gambling, and relationships, and substances, alcohol, drugs, even food, can come into play here. There are medications that can help with specific addictions. The addictionrecoveryguide.org is a site used to pull a lot of this information, and it is very helpful. For nicotine addiction, nicotine replacement can be used with the patch, with inhalers for the nose or for the lungs. Varenicline is a prescription medication. Bupropion is another. Clonidine for inhalant abuse, such as gasoline or huffing hydrocarbon solutions. Vigabatrin is an anti-seizure medicine that's been helpful. For opiates or pain pills, buprenorphine is a new addition to the scene. Naltrexone is an agent that blocks the effect of opiates completely. Methadone has been used for years. Tisipramine is a tricyclic antidepressant that also helps with cravings and management of opiate addiction. Opiates, again, are pain pills. Cocaine addiction can be helped with gabapentin, another seizure medicine, vigabatrin. baclofen, and acetylcysteine, which is used to detoxify the body from a variety of things. The liver uses this to help pull poisons out of our body. Nocaine is not in use in the United States, but is available overseas. Disulfiram is a drug that's been around to treat alcohol addiction. And modafinil. Methamphetamine can be helped with paroxetine, bupropion, modafinil, and mirtazapine. For alcohol addiction, there is topiramate, baclofen, naltrexone, disulfiram, Camprol, ondansetron, varenicline, gabapentin. For sexual addiction, there is paroxetine. For attention deficit disorder, we will refer to the information from Dr. Hoffer's ABC of Natural Nutrition for Children by Abraham Hoffer. Hyperactivity, inattention, impulsivity that are inappropriate for the child's age is what characterizes attention deficit hyperactivity disorder. First that needs to be done is to rule out learning disabilities. Food additives, allergens, and sensitivities may also be major factors. Avoiding additives and testing for other problems are important initial steps in the management of ADHD. We also need to make sure there's no evidence of otitis media with hearing loss, nutrient deficiency, or heavy metal toxicity. Elimination diets can be helpful, but if formal testing is unavailable, but formal testing is a better way to go. For elimination diets, start with what we call an oligoantigenic diet. It's a very pure diet with very little refined foods in it. Then add a different food over time as a full serving once a day, 1 day a week initially, and then advancing. If there's no improvement with this protocol, further testing for environmental exposures may be needed. It's very important through this entire sequence to avoid all refined sugars. Also avoid all dyes and additives. For nutritional support, vitamin C, 4 to 8 grams a day in divided doses, which should be given below the bowel tolerance, are important. Bowel tolerance with vitamin C is an important concept. Too much vitamin C causes diarrhea, and everybody has a slightly different bowel tolerance. When you get up to the bowel tolerance limit, loose stools would begin. Once that limit is breached, after you get higher than that, the loose stools continue. You'll have to back off to get below that limit. Interestingly, though, when somebody is sick, their bowel tolerance improves. So if 4 grams of vitamin C a day caused some mild diarrhea in a person when they're healthy, if they get the flu or get sick, they may tolerate 8 grams a day without having any bowel problems. The body will absorb more as needed. Vitamin C is very interesting that way. Vitamin B complex, 100 milligrams once or twice a day, can be helpful with attention deficit. A good multivitamin once a day is also very important. I like to see those given with minerals. Niacinamide, or vitamin B3, this is an analog, a derivative of vitamin B3, 500 milligrams 3 times a day. Niacin is the main form of vitamin B3, and at this dose it would cause really intolerable itching, flushing, and burning of the skin. The niacinamide form of it does not cause this. Fish oil contains DHA and EPA. 1 to 2 capsules twice a day is a very good place to start with attention deficit disorder. Calcium, 1,000 milligrams, generally given at bedtime because it can have soothing, calming effects. Given during the early morning, it might cause a little bit of sedation, but at night that's a welcome side effect. Managing aging and bioidentical hormone replacement therapy, which has been abbreviated as BID-HRT. Toxin removal is important with aging. Toxins do accumulate over time. They damage our cells. Heavy metals are huge culprits. Gasoline used to contain lead. Fin fish contain mercury. Arsenic is in shellfish. Cadmium is found in tobacco products, including secondhand smoke. Heavy metals hide in certain tissues, such as our bone, and also especially in fat, especially the insulation around our wires, our neurons. These are known as myelin sheaths and Schwann cells within our brain. They cause damage over time. They are not metabolically inert. They are active. They can only appear in lab tests immediately after or a significant exposure before they have a chance or after giving a chelating agent to pull the agent from its hiding place so that it can be found and eliminated. Bioidentical hormone replacement therapy. Typical hormone replacement therapy is done in the United States. It's not done with non-patentable original equipment hormones that God provides for us. Those cannot be patented. The pharmaceutical industry instead takes these basic chemicals and modifies them just a little bit so they can be patented. With these chemically modified hormones, huge profit potential is available. Breast cancer is very rare in the fertile premenopausal women who are not on synthetic hormones for the most part, although contraceptives that have been taken in the past may also have these synthetic hormones. The Women's Health Initiative was a large study that looked at hormone replacement therapy. Unfortunately, it looked at standard commercial pharmaceutical grade hormones, and unsurprisingly, they were found to be associated with an increased risk of stroke, heart attack, dementia, various cancers, etc. Andropause refers to menopause in men when their testosterone levels drop off. With the loss of testosterone, muscle mass declines, muscles weaken, stamina disappears, reflexes slow. Topically applied bioidentical hormones can be given to women and to men. Estrogen comes in three forms: estrone, estriol, and estradiol. Estrone is the most likely to cause cancer. Typically, it is in low levels in human beings. All the different mammalian species have different ratios of the three different estrogens. With human beings, the ratio is approximately 85% estradiol and 13% estriol. Topically applied bioidentical hormones can be given to women. Women who have a uterus need to have progesterone included in this. Also, most artificial progesterone is not really pure progesterone. It's what we call a progestogen, or a precursor of progesterone. Dihydroepiandrosterone, also abbreviated as DHEA, is the parent hormone, comes from cholesterol. It's used to make all of the different sex steroids. It's typically also a part of the bioidentical hormone replacement therapy protocol. A unique formulation of estrogens, progesterone, and testosterone. Yes, the ladies also like the testosterone. It does promote the sex drive or libido. And the DHEA can then be tailored to fit each lady's individual metabolic needs. And obviously for men, testosterone and DHEA can also be given. The formulations are typically created for women as a cream that's applied inside the arm or thigh twice daily for menopause symptom relief. Men can receive topical or injected testosterone in an oil base which slows absorption, so the shot should last several weeks. They should also take saw palmetto or finasteride, which is a prescription drug, to shield the prostate from the effects of testosterone. Excess testosterone causes prostate growth and eventual prostate cancer. Also, sometimes agents such as diindolylmethane or DIM or anastrozole, which is a prescription, can be given to steer the steroid metabolism away from estradiol production more toward testosterone production. Thyroid function needs to be evaluated with bioidentical hormone therapy and aging as well. The thyroid sets the idle speed for every cell in our body. Activity and levels of the hormones decline with age. This happens with all hormones. T4 is made by the thyroid gland. In the periphery, T4 is converted to the active form known as T3. Typically, standard therapy is to replenish T4 only, allowing conversion to take place in the periphery of the body, but that doesn't always work well as we get older, so some physicians will give either a combination of both T4 and T3 or the pure T3 triiodothyroxine instead. Thyroid function testing and blood work are a good tool, but they can be misleading. A good clinician will treat the patient, not just the lab values. Sometimes proper therapy involves having the patient feel good, accepting some slight abnormality on lab values. That said, however, too much thyroid activity can increase the rates of osteoporosis. Medicine is a complicated process. Adrenal function. Short-term stress can cause the release of adrenaline, also known as epinephrine. Long-term stress, after the adrenaline levels fatigue and fall off, leads to cortisol production. The adrenals can then become subclinically fatigued, not as severe as with Addison's disease, but with clearly abnormal labs. Adrenal support formulations are available. These can help with fatigue, weakness, loss of stamina, endurance, cloudy thinking, slow movements, etc. that are common with aging. DHEA is the sex steroid precursor hormone. Phenylalanine and tyrosine are adrenaline precursors. GABA is a neurotransmitter precursor. It's an amino acid. And herbal preparations such as ashwagandha, holy basil, and rhodiola, as well as wild oats and schisandra, can all help with the adrenal support and to help them to recover from the excess effects of stress on them over a prolonged period of time. Anemia. This information, again, will be taken from the Encyclopedia of Natural Healing, 2nd edition. Patients with anemia are typically pale, weak, and have a tendency to fatigue easily. This can be due to either low blood volume, low total blood cells, or low hemoglobin within the cells. There can also be abnormal hemoglobin size or shape in the blood cells. The anemias are classified typically by the size and the color of the red blood cells. Hyper, hypo, or normochromic, it refers to color intensity. Hyper, hypo, normovolemic refers to the size of the blood cells. The cause of the anemia must also be determined. For proper treatment of anemia, the type must be correctly and accurately diagnosed. Iron deficiency anemia is the most common type. For iron deficient anemia, iron is given 30 milligrams either as a succinate or fumarate salt twice daily. If abdominal discomfort is present, 30 milligrams can be taken 3 times a day with meals. Alternately, a high-quality, well-hydrolyzed liver extract that provides 4 to 6 milligrams of heme iron works well too. Vitamin C, 1 gram 3 times a day, should also be taken. For B12 or folate B9 deficiency anemia, 2 milligrams a day for at least 1 month, followed by 1 milligram a day of vitamin B12, is given. Folate, 1 milligram, can be given 3 times a day at the same time. Both are always treated together. Treating one B12 without the folate or vice versa can mask a deficiency of the other with a very poor outcome. It's best to always avoid this. Anxiety is the next topic we'll cover. Again, taken from the Encyclopedia of Natural Medicine, 2nd edition. Elevations of the blood lactate level are the single most significant associated biochemical disturbance associated with anxiety. Causes could include caffeine intake, sugar, concentrated sweets or refined sugars, vitamin B deficiency, including thiamine, B1, niacin, B3, pyridoxine, B6, and others, calcium or magnesium deficiency, and food allergens or foods that one has been sensitized to. Correcting the issues above are essential to controlling anxiety disorders. Nutritional supplements for anxiety include high-potency multivitamins with minerals taken as 1 daily, flaxseed oil, 1 tablespoon daily or 2 to 3 times a day, niacin, vitamin B3, niacinamide can also be used, vitamin C, 1,000 milligrams at least 3 times a day, lecithin, chromium, 25 to 35 micrograms per day. Botanical supplements can include kava, pipermethysticum, 200 milligrams twice a day, valerian, 400 to 900 milligrams at bedtime. Be careful with the valerian, however. It can be toxic to the liver. It affects the GABA receptor, so withdrawal syndrome is possible, and it can be associated with issues in terms of habituation, possible addiction. This is noted from the Wikipedia article on valerian, the herb. Lifestyle modifications. You should try to identify and reduce or eliminate any stressors. Identify and change any negative coping patterns with positive patterns of coping. Relaxation, meditation, prayer, breathing exercises for at least 5 minutes twice daily. Regular aerobic exercise is also very important. managing your time effectively. Enhancing relationships through better communication is also of paramount importance. Atopy and eczema, again from the Encyclopedia of Natural Medicine, 2nd edition. This is a chronic, itchy, inflamed, dry skin that's been described as an itch that rashes. Food allergy is often the cause. Milk, eggs, peanuts account for 81% of childhood atopy. There can also be food sensitivities that are mediated by IgG, not IgE. Therapy involves reducing the load on the immune system by identifying and eliminating allergens and sensitizing substances, while inhibiting the tendency to release histamine and other inflammatory agents into the skin, such as cytokines, leukotrienes, etc. Diet, eliminating allergens and sensitizing agents such as milk, eggs, peanuts, can improve 80% of people. Limiting the use of animal products is also helpful. Encourage fatty fish consumption such as salmon, mackerel, herring, halibut. Nutritional supplements, vitamin A, 5,000 units a day. Vitamin E with mixed tocopherols, 400 international units a day. And zinc, 45 to 60 milligrams a day, decreased to 30 milligrams when the inflammation problem and the allergies inflammation is improving. Nutritional supplements include flavonoids, such as quercetin, 400 milligrams 20 minutes before meals, grapeseed extract, 50 to 100 milligrams 3 times a day before meals, green tea extract, 200 to 300 milligrams 3 times a day before meals, ginkgo biloba, 80 milligrams 3 times a day before meals, and of course fish oil, EPA and DHA, 3 times a day before meals, or flaxseed oil, 1 tablespoon a day. Other botanicals that can be used for atopy and eczema include Glycyrrhiza glabra, or the licorice root, powdered root, 1 to 2 grams 3 times a day, fluid extract, 2 to 4 cc's a day, solid dry extract, 250 to 500 milligrams, Arctium lapa, or the greater burdock, also Taraxacum officinale, dandelion, dried root, 2 to 8 grams by infusion or decoction, fluid extract, 1 to 2 teaspoons, tincture, alcohol-based, not recommended due to the high dosage required, and the juice of the fresh root, 1 to 2 teaspoons. Powdered, solid, or dried extract, 250 to 500 milligrams can be used. Coleus forscolii, 50 milligrams, 9 milligrams of the forskolin is required. Topically, choose the commercial preparation containing glycyrrhetinic acid, chamomile, or witch hazel. Avoid rough textured clothing. Wash the clothing in mild soaps and rinse thoroughly. Avoid exposure to chemical irritants. Use local soothing lotions to help the itch. Zinc oxide works well, but avoid greasy preparations that block the sweat ducts. Bipolar disorder. The diagnosis of bipolar disorder requires at least 3: excessive self-esteem or grandiosity, reduced need for sleep, extreme talkativeness or excessive telephoning, extremely rapid flight of ideas with feeling that the mind is racing, inability to concentrate, the patient is usually very easily distracted, increased social or work-oriented activities, poor judgment including uncontrolled spending, misguided financial decisions, excessive sexuality with loss of control of sexual impulses. Hospitalization may be required, especially during periods of mania. Vanadium levels are directly correlated with mania. Vitamin C, 3 grams per day, results in significant clinical improvement. Dietary interventions, a low vanadium diet, no processed or refined foods, consumption of fresh fruits and vegetables. Nutritional supplements include high-potency multivitamin with minerals without vanadium, taken once daily. Phosphatidylcholine, 10 to 25 milligrams daily. Vitamin C, 3 grams per day in divided doses, such as 1 gram 3 times a day. That would be 1,000 milligrams 3 times a day. Biliary disease and gallbladder disorder, again taken from the Encyclopedia of Natural Medicine. This can be asymptomatic with no problems, no symptoms at all, or you may notice that after meals there's pain in the right upper quadrant of the abdomen. It may radiate to the shoulder, possibly with nausea, vomiting, bloating. Ultrasound is good to help diagnose this. It can be prevented often through diet and lifestyle. Fasting or severe caloric restriction can cause stones to form. Coffee causes the gallbladder contraction, which can cause severe pain. A low lecithin in the diet and in the bile may cause these stones to form, so lecithin supplementation can be helpful. Vitamin C, 2,000 milligrams a day, changes bile composition, reducing stone formation. Milk thistle can help dissolve stones due to the increased bile solubility. A complex of plant terpenes alone or in combination with oral bile acids can also help to dissolve bile stones. Stones are easier to prevent than they are to reverse. A healthy, high-fiber diet helps to prevent stones. Once stones have formed, increasing the bile solubility reduces the risk of pain. Avoid sensitizing and allergic foods. Also, fatty foods will aggravate biliary pain. Dietary measures. Increasing the intake of fruits and vegetables, dietary fiber, especially the gel-forming mucilaginous fibers such as flaxseed, oat bran, guar gum, and pectin. Reducing consumption of saturated fats, cholesterol, sugar, animal proteins, and fried foods. Water, 6 to 8 glasses a day, helps to prevent some mild dehydration and overconcentration of the bile, which is essential for stone formation. Nutritional supplements. Vitamin C, again 500 to 1,000 milligrams 3 times a day. Vitamin E, 200 to 400 international units daily. Phosphatidylcholine, found in lecithin, 100 milligrams 3 times a day. Choline, 1,000 milligrams daily. L-methionine is an amino acid, 1,000 milligrams of that once a day. Fiber supplementation to a minimum of 5 grams per day, especially the mucilaginous fibers, as noted in the last slide. Bile acid supplements, such as a combination of ursodeoxycholic and quinodeoxycholic acids, 1,000 to 1,500 milligrams daily. Botanical supplements. There's a gallstone dissolving formula that can be taken 1 to 3 times a day. It's best if used with the ursodeoxycholic acid. This involves using menthol, 30 milligrams, menthone, 5 milligrams, pinene, 15 milligrams, borneol, 5 milligrams, camphene, 5 milligrams, cineol, 2 milligrams, citrol, 5 milligrams. Peppermint oil in enteric-coated capsules can also be used instead of the formula above at a dose of 1 to 2 capsules 3 times a day between meals. Milk thistle, Silybum merianum, dosed based on the level of the silymarin, 70 to 210 milligrams per dose is essential. Cyanera scolymus extract, 500 milligrams. Pubis boldo, the dried leaves or infusion, 250 to 500 milligrams. Tincture, 2 to 4 cc's. Fluid extract, half to 1 cc. Curcumin longa, 100 to 200 milligrams 3 times a day. Dandelion, Pteroxychum officinale, dried root, 4 grams. Fluid extract, 4 to 88 cc's. Solid extract, 250 to 500 milligrams. Blood type and diet. This is adapted from a book written by Peter J. Diadamo, a naturopathic physician. The title of his book is Live Right for Your Type. There are 4 major blood types by the Lewis antigen system, the A, B, ABO system. 40% of the population is type O. They have no A or B antigen. Type A antigen can be present in 0 to 32%, type B in 0 to 22%, AB is the rarest, found in 6% of the population. The Rh factor is different but important for typing, although we don't need to worry about this for the concept of this blood type and diet discussion. Type O. These folks may have evolved as early hunters. They function best with a high-protein diet. They need aerobic exercise to reduce stress. They're resistant to many infections and cancers. They tend to be extroverted, impulsive by nature, yet practical, decisive, and they live in the present. Type A blood types. They may be an evolutionary step that separated the first hunters from the first farmers. They do better on a predominantly vegetarian diet. Yoga or gentle exercise is their best stress reliever. They need frequent breaks or naps to stay focused. They need a regular sleep cycle, especially as with aging. They tend to be more introverted, calm, and prone to anxiety and sensitive to the needs of others. Type B. This is a hybrid of type O and type A. They should focus on creative outlets. Walking and meditation help reduce stress. They should try to avoid overreacting with aging. Mental activities are crucial to retaining memory. They are somewhat self-sufficient, but may be emotional at times. They may also be a bit more free-thinking, but they at times may seem to lack ambition to a degree. Type AB. They have components of all three characteristics above. They need smaller, more frequent meals. They should try to break up the day with exercise to maintain focus. They're more prone to bacterial infections. They're more spiritually focused, sensitive, intuitive, and focus more on feelings. Comments regarding the blood type and diet concept. When eating right for your type, you'll likely have a higher active muscle mass with a corresponding higher basal metabolic rate, which means that more fat is being burned without losing muscle. Type O and B have more carbohydrate than lipid intolerance. They do better on the Atkins diet. Type A and AB have more of a carbohydrate than lipid tolerance. The Pritikin diet would be a better choice for them. The benefits: choosing the right diet will help to optimize energy and sense of well-being, weight loss, digestion and elimination, immune system function, reduces cancer risk, helps with overall health including the musculoskeletal system, cardiopulmonary health, hormonal and reproductive balance, and neurological and psychological state and sense of well-being. Lab tests. An Indican urine screen can look for residue of unabsorbed proteins in the digestive products. There will be inappropriate conversion of tryptophan to urinary indoles. They may need to be run twice a year to ensure that the person is doing adequately on their current diet. Indoles and indican production will decrease with proper diet and have been linked with a higher rate of cancer when they're elevated. Lectins and proteins are found in foods that interact in different ways according to blood type. Foods that contain lectins incompatible with your blood type interfere with digestion, metabolism, and immune function. Polyamines. These are found in vegetable products and fermented foods. They are released in production of toxic putrescine, spermidine, and cadaverine. These are foul-smelling compounds that may be noted in intestinal gas. Polyamines can be lowered by lectins, walnuts, green tea, dark blue, purple, or red pigmented fruit, plantains, guava, pomegranates, onions, dill, tarragon, or broccoli. They're associated with an elevated serum albumin level, high urinary indican, halitosis or bad breath, and headache being caused by fermented foods. Lectins, they nourish the gut wall. They also tend to sequester the polyamines to promote healing. Benign prostatic hypertrophy, again from the Encyclopedia of Natural Medicine. Over 50% of men will develop this in their lifetime as a result of testosterone influence that occurs over time. The PSA test can help distinguish between enlargement of the prostate and cancer of the prostate, but is best combined with a physical examination, including a prostate exam by finger. Zinc is vitally important for treatment. Cholesterol damage by free radicals is particularly toxic and is carcinogenic to the prostate. Increased soy consumption has a protective influence. In Europe, plant-based medicines are the most popular prescriptions for benign prostatic hypertrophy. Saw palmetto is commonly used in this country as well. The treatment goal is to normalize prostate nutrient levels and size of the prostate, inhibit excessive conversion of testosterone to dihydrotestosterone, and limit the dihydrotestosterone receptor binding and production of prolactin, which also promotes prostate cell growth. Diet for BPH. There are no good clinical trials on diet. However, a logical approach would be a high-protein, low-carbohydrate, and animal fat diet with a high essential fatty acid intake with more unprocessed foods, grains, beans, vegetables, fruits, nuts, and seeds. Elimination of alcohol, especially beer, and elimination or reduction of caffeine and sugar. And also regular use of nutritional supplements. Zinc, 45 to 60 milligrams, helps with the prostate. Flaxseed oil, 1 tablespoon daily. Amino acids, especially glycine, 200 milligrams a day. Glutamate, 200 milligrams a day. Alanine, 200 milligrams a day. Botanicals, saw palmetto, Serena replenens, 160 milligrams twice a day. Also, flower pollen extracts such as sternilton, 63 to 120 milligrams, 2 to 3 times a day. Pygeum africanum extract, 14% triterpenes and 0.5% endocosanol, 50 to 100 milligrams twice a day. Stinging nettle, Urtica dioica, 300 to 600 milligrams a day, can also be helpful. Bronchitis and pneumonia, again from the Encyclopedia of Natural Medicine. Most cases of bronchitis do not require antibiotics. Most cases of bronchitis are due to viruses. They do not respond to antibiotics. The natural approach to treating bronchitis has 2 primary goals. First, to stimulate production of normal processes that promote expectoration and removal of the mucus that protects the airways, and secondarily, to enhance the overall immune system function. Vitamin C supplementation is suggested to bowel tolerance. Postural drainage and local heat can also be quite helpful. Bromelain is a protein-digesting enzyme complex that can help to break up mucus. Botanical expectorants increase the quantity of sputum while decreasing the viscosity of the secretions. Zucol cough drops contain an extract of Pelargium that has a strong effect against the germs that cause bronchitis. There's also a homemade expectorant that can be made with 2 ounces of licorice root, 1 ounce of wild cherry root, 1 ounce of coltsfoot, 1 ounce of lobelia, 1 ounce of horehound. Mix them all together, boil in 4 cups of water for 2 minutes, steep for 10 minutes, strain and take a cup every 2 hours for adults, a half a cup for children, sweetened with honey if necessary. Basic care, bed rest, large amounts of fluids. Your sputum will be more dilute and less sticky if you've got enough fluid in your sputum, and the best way to do that is to just take lots and lots of fluids by mouth. Dilute vegetable juices work well. Soups and herb teas are also advised. Limit simple sugar consumption, but this will include fruit sugars, by the way, to less than 50 grams a day. Supplements, vitamin C, 500 milligrams every 2 hours or to bowel tolerance. Bioflavonoids, 1,000 milligrams a day. Vitamin A, 25,000 units per day, unless the patient may be pregnant or of childbearing age, at which point it would be best to keep that under 5,000 units a day. Beta-carotene can be substituted for vitamin A at a dose of up to 200,000 units a day for non-pregnant ladies. Zinc lozenges, 23 milligram lozenge every 2 hours while awake, can also be helpful. Bruising. The first thing to do is limit medications that can thin the blood and promote bruising. Things such as aspirin, non-steroidal anti-inflammatory drugs, NSAIDs would include ibuprofen, marketed as Advil, or naproxen, which is marketed as naproxen. Supplements. Vitamin C, 1,000 milligrams or more a day is tolerated. It helps to strengthen collagen and thus the blood vessel walls. Quercetin, 600 to 1,000 milligrams daily for at least a 3-month trial. Copper and zinc are very important. These are trace minerals that are usually present in multivitamins, but excess doses can be taken as well. Vitamin K should only be used under medical supervision. However, green leafy vegetables are natural sources of vitamin K, and they can be taken for those who are not taking Coumadin or other blood thinners. Cancer prevention. This comes from the website dryourself.com. Diet. High potassium, low sodium, low fats and oils. Minimal animal protein. Juices provide protection against oxidizing enzymes, facilitating rehabilitation in the liver, such as fruit juices, vegetable juices. Raw liver can actually be juiced as well. Supplements, including carotene, which is a vitamin A precursor. The dose they describe has been used up to 500,000 units a day, but this dose has also been linked with increased rates of lung cancer and should probably be avoided. However, it's brought up as just a mention for anybody that cares to go to that website and look more deeply into it. I'd like you to be aware that there is a potential risk at this high dose. Less than 5,000 units is a pretty good dose for daily intake, especially for women that may be pregnant, as higher doses of vitamin A have been linked with birth defects and other problems. Vitamin B2 and also folate B9, 1 up to 30 milligrams a day. B3, niacin, 1 gram 3 times a day. Vitamin C helps to prevent the flushing that's associated with vitamin B3 or niacin uptake. Inositol hexanicotinate prevents the flush. It's metabolized to vitamin B3. Vitamin B complex, 100 milligrams a day. Also, back to the vitamin C dose with niacin, I find it usually a 2-to-1 ratio, 2 parts vitamin C to 1 part niacin on a milligram to milligram ratio helps to prevent that flushing that happens. Vitamin C can be taken throughout the day to bowel tolerance. Remember, it's a water-soluble vitamin, so as soon as it's taken, your kidneys are getting rid of it. Vitamin E, 800 to 1,200 units a day. Selenium, 200 to 1,000 micrograms a day. Vitamin CoQ10, it's not really a vitamin, but it can be considered as such, 300 to 600 milligrams daily, especially useful for helping get rid of breast cancer. Calcium, 500 milligrams 3 times a day, although it can cause constipation. It's good to mix this with magnesium, 250 milligrams a day, which loosens the stool. Stool must be kept moving to detoxify properly. And you can adjust the calcium, in fact, magnesium ratios as needed to keep your bowels moving properly. Supplements have been found helpful for specific cancers. Breast cancer tends to respond with vitamin CoQ10 supplementation. Bladder cancer to vitamin B6, pyridoxine. Prostate to zinc, 40 to 150 milligrams a day. Lung cancer does well with folic acid and also with vitamin B2 supplementation. Candida overgrowth syndrome. This is taken from the Encyclopedia of Natural Medicine. Prolonged antibiotic use predisposes one to overgrowth of fungal infections. Recurrent and/or chronic overgrowth can occur with a depressed immune system as well. Restoring normal immune function is the key goal in treating chronic Candida infection or colonization. The most effective natural anti-Candida compounds are enteric-coated volatile oil preparations. Eliminate wherever possible antibiotics, steroids, immune-suppressing drugs, birth control pills. Identify any lack of digestive secretions, especially IgA, which is the antibody that's found in mucosal productions in the gut especially. Identify any food sensitivities, allergies, abnormalities in digestion of any particular food groups. IgA and IgG food allergies and sensitivities, such as gluten, liver function abnormalities, may be noted. There are many tests to look for immunity impairments for folks who have this issue going on. The candidate control diet involves elimination of refined and simple sugars, milk and dairy products, yeast or mold, including alcoholic beverages, breads and cheeses, dried fruits, melons, peanuts, all known or suspected foods that one may be allergic or sensitive to. Provide nutritional support in the form of high-potency multivitamins with minerals daily. Provide additional antioxidants, flaxseed oil, at least once a day, and support the immune system, maintaining a positive mental attitude. Avoid stress, smoking, sugar. Get plenty of rest and good sleep. Support the thymus by taking thymus extract, 750 milligrams of crude polypeptide fractions daily. 3 to 5 grams of water-soluble fibers such as guar gum, psyllium seed, or pectin at night can be helpful. If liver problems are present, take lipotropic factor and silymarin to promote liver function. Probiotics can be useful. 1 to 10 billion viable Lactobacillus acidophilus and Lactobacillus bifidi daily can be helpful. Anti-yeast therapies such as clove, oregano, and prescription medications such as nystatin can also be quite helpful. Carpal tunnel syndrome, taken from the Encyclopedia of Natural Medicine. Supplements: vitamin B6, pyridoxine, 25 milligrams 3 times a day, acts as a bit of a diuretic, promoting water loss, thus reducing swelling. Vitamin B2, riboflavin, 10 milligrams a day. Bromelain, 250 to 750 milligrams twice daily. Diet: avoid foods with yellow dyes. Limit protein intake to about 1.65 grams per pound of body weight daily. Additional measures: acupuncture has been shown to be helpful, as has been physical therapy. Splinting, starting off at night, or if it's very severe, wear a splint day and night, a wrist cock-up splint. Alternating hot and cold water soaks, known as contrast